everybody, back again at Connect with Christina. And I am very happy because with me, my very dear friend, Dr. Yaz. Well, we call her Dr. Yaz, but you can introduce yourself properly.
I'm Dr. Yazmine Rahimi with Backfit Health and Spine.
Not to point it out, but I'm going to point it out. Doc, you look 30-ish. So
Thanks.
I don't know what your routine is, but we're going to break that down today so you can help a lot of us women as we age up gracefully. But before we dive into that, explain or share your background, because you're quite phenomenal in this space and we want to know a little bit more about that.
So I'm a chiropractor by trade and acupuncturist, but we've been around for 23 years in the Valley. We now have 10 locations, including Tucson and Vegas, and we're chiro, medical PT, acupuncture, and massage. So we do everything from pain-related stuff to functional medicine, lab work, bioidentical hormone replacement, to medical weight loss. We take health insurance. We take car accident cases. We take it all.
Cash pay.
Whatever. Mm-hmm.
What got you to get into this space to begin with? I didn't know it has been 23 years.
Yeah.
I think I was surprised about that.
Yeah, so my undergrad is in exercise kinesiology. I've always been a bit of a health nut and exercise freak.
Do tell.
I was a very competitive tennis player, and I tore my shoulder and had my own injury, and I went through countless injections, short of getting surgery done on my shoulder. They, for lack of a better phrase, they jacked me up, really. So then I went to a chiropractor that did PT and did all these different alternative modalities, and it was life-changing for me. So it made me think, you know what, I should probably change my direction. And I was an undergrad. I should probably change my direction and go more towards holistic healthcare rather than what I was thinking of. I was already pre-med, but I was thinking I would go the medical route and go into orthopedics, but this just totally changed my thought process. So
That's so interesting that like something that happened to you,
yeah,
essentially like helped you pave a way of this direction.
Yeah, going through my own pain and struggles with this, because the shoulder is the hardest joint in the body to rehabilitate because it has the most range of motion. So it's very unstable and very easy to tear, strain, to dislocate. So going through and learning how to do that, I was known as like the shoulder specialist, because I knew how to fix a shoulder short of surgery. I knew what to do. So it was just something that, I could empathize with the patients because I went through it myself.
So when you say you were injured and then that that you got jacked up, like what does it mean? Like,
so I had a partial tear of one of my rotator cuff muscles, and they were doing everything they could to prevent surgery from me, even though I probably should have just had surgery and fixed it. But they had done, you're only supposed to do one cortisone injection in the shoulder. Back then, this was 30 years ago, once a year, maybe twice a year. They did 3 in my shoulder in 6 months. So not only did I have a complete reaction systemically, I got swollen everywhere. I had my whole left side of my body was swollen. I couldn't move my neck.
That sounds painful.
It was horrible. So
and how long was that going on?
So I had the reaction to my injection probably completely left my system after like 3 months.
Wow.
Yeah. It was a while.
During that time, PRP wasn't a thing yet.
No, this was 30 years ago. I mean,
well, you look
more than 30 years ago. It was, probably 33 years ago, yeah.
To now having PRP, like how would that have played a role in that for you?
PRP could definitely have helped. It does help rebuild fibers, but I was in such a bad shape, I probably should have had surgery.
So when people are out there, having this type of injuries, where would you say that the first step for them, like who do they go see right away?
Yeah, I always recommend that whether it's a friend or a family member or a patient, I always say start conservatively first. Let's just get imaging. Let's see what it looks like. Let's get an MRI. Let's get a CT scan. Let's see what it looks like. Then we decide where do we go from there? Is this something that we can fix conservatively, or is this something that we need to, refer out? So we always start conservatively.
So you don't just jump into surgery.
No, I mean, people are willing to do that when they just don't know any better, right? They think, oh, I tore something, I need to go to a surgeon. Well, a surgeon's going to say, I can fix this, and the only way they know how to fix it is by cutting it, right? So, and every specialty is going to recommend what they like to do and know to do.
That's a good point.
It's not that, they're trying to mess you up in any way. It's just that their scope is
what they know.
The providers we have, we're kind of gateway providers, right? So we know what we know, but we also know what we don't know. So we're going to refer out. So if that means that we refer out to a pain specialist or an orthopedic or neurologist, whatever it is, whatever you need, yeah, they get referred out.
That's good to know. Mm-hmm. The rotator thing for me, when I extend my right side, if I'm cooking, it just wants to drop. But I've not really fixed it because it's a perfect excuse not to cook, not to clean. I'm just kidding. Sorry, guys. Yeah. Okay. Now, Doc, I really have been wanting to ask you a bunch of questions about your routine, your day-to-day routine, as to why you don't just look amazing and look super, super young, but also your energy level, your attitude, just like your entire outlook in life. And I know it has something to do with your just your routine and the wellness and the steps you take in that. And we want to help more and more people with that, how to be healthier, eat better, what type of exercise, certain ages are different. So I want you to share that. How do you even start your day?
There's so much to unpack this is like a whole different conversation. I've always been into fitness. I've always been very regimented with my workouts. I always made sure I got my cardio in, I got my weights in. This is all after playing sports, but I always worked out. Even in undergrad, I was a trainer. I was a personal trainer at the rec center at University of Arizona. I was always in that space, right? But now, so I'm going to be 50 this year, and going through perimenopause.
Say that again. I'm so sorry. What?
I'm going to be 50 this year. Going through perimenopause and menopause, it's totally different. My day-to-day now is nothing what it was even 5 years ago. So I think first and foremost is nutrition. I make sure I eat at least 100 grams of protein a day because I need to maintain my muscle, because my muscle is the only thing that's going to keep me young. So, and the more muscle you have, the more, not only the leaner you stay and the more metabolically sound you are, but anytime you have something that's I love a glass of wine, right? So if I have a glass of wine that has a lot of carbohydrates, I know because I have high muscle content, that's just going to sweep all the glycogen, all the carbs from that glass of wine. It's not going to affect me like it would someone who's got 30% body fat, right? So if I eat my protein and I lift weights at least 3 to 4 times a week, that's all I need to do.
You're super big on the muscle thing.
Yeah, muscle is the organ of longevity. It is the only thing that's going to guarantee you longevity.
Yet people are so focused on doing aerobics or
cardio.
Yeah,
cardio burns muscle. So the more cardio you do, your heart is going to be stronger. And you need a little bit of cardio. I walk. That's about the most cardio I do nowadays is I walk 20 minutes a day, maybe, if I have time. If I don't have time, I make sure I lift my weights because I can get a little cardio in with my weight training, but I don't do pansy 10-pound dumbbells, right? I'm push pressing 80 pounds. I'm squatting my body weight. I'm deadlifting my body weight. So I'm not, I always tell my girlfriends, do Pilates and yoga on your off day, your rest day. That's not going to build muscle. It's going to give you mobility. It's going to give you core stability, but it's not going to build muscle. You have to build. You have to activate your muscle to build more muscle.
Okay, but then it brings me to the point, though, that because you already had great routine in your 20s and 30s and 40s and now 50s, obviously all of those has helped put you where you are now and then allowing you to still look good, feel good, and all those things.
Right.
But for ladies that are, say, 40, what is the main thing that, that we should think about?
What can you do now?
Yeah.
You have to lift weights. Lift 3 times a week, full body. And it doesn't have to be anything complicated. You could do a squat, going into a deadlift, going into a row, all with one barbell, going into a push press, and that's it. Do that 4 or 5 rounds. That's all you need. It doesn't have to be, complicated movements and glutes on one day, legs on another, shoulders on another. No, just do 3 full body workouts a week and walk for 20 minutes a day.
So go back to your routine right now. So you wake up and what do? Do you drink a glass of water first?
So I always drink a glass of water first. I always have at least a triple espresso.
Do you really?
I do, yeah.
Oh my God,
I do.
Bouncing off the walls.
I have 3 shots of espresso. So I get up at 5. I drink my water. I do my espresso.
But why the water, I want to ask?
Because when you wake up, you're dehydrated.
Okay.
So you have to drink water.
Okay. Or anything else?
It's just good. It's just good practice. I don't put lemon in it. It's just water.
Okay.
Just regular water. If you want to put lemon in it, that's fine, But I do 3 grams of creatine every day. In my, I'll do a collagen drink. So after I drink my coffee, I have a drink that is a collagen pre-workout.
Okay.
It doesn't really have any caffeine in it, but it's just, it has collagen in it, some electrolytes. It might have green tea extract, but no significant caffeine. And then I add my creatine to it. And that really helps with my energy for my workout, especially if I'm lifting weights that day. Even if I'm not working out, I drink creatine.
Okay.
I add creatine.
And that's good for?
Creatine helps maintain your muscle, but it also helps your cognition as you age. So it helps prevent Alzheimer's and dementia.
This is why we're asking Doc. Okay.
Yeah. So it really helps with cognition. It's a really good anti-aging. And anytime you're going through perimenopause and menopause, women lose 3% of their muscle mass a year. That's a lot.
That's crazy.
3% is a lot. So I've been doing bioidentical hormone replacements since I was 38.
And do you guys do that at Backfit?
We do, yeah.
Okay.
We do. So we run full labs on everyone. And then we check their testosterone, their estrogen, progesterone, thyroid. And our providers are trained to balance all those out.
And that's obviously important. Why?
Because as you age, your hormones drop. So women need testosterone. Normal testosterone levels for women is roughly anywhere between 50 to 75. Mm-hmm. Most women run at my age group, they run maybe 5 to 10. It's very low. So adding testosterone not only helps your energy levels, your libido, it helps maintain your muscle. It just helps your overall mood and well-being. And then your estrogen, as your estrogen drops, that's a huge one we see in our clinics. When women are going through perimenopause and menopause, their estrogen drops. And what happens is not only do they get the obvious things, right, like
fatigue,
losing
hair.
Losing hair, mood swings, right? But things that we don't know is related to low estrogen, which is less collagen production, so you get more wrinkles. You get less, your hair, right? Obviously, your hair starts falling out. But the thing we see in our clinics, and you get skin irritations. The other thing we see is in our clinics, because we're primarily pain clinics, is your joints ache a lot. And I'm not talking about, I have a little bit of, neck pain or what. It's you wake up out of bed as if you've been run over. You feel like you've been in a car accident every day,
over.
Everywhere. Yeah, like you have the flu, everything hurts. We see a lot of plantar fasciitis with low estrogen, a lot of tears, because our ligaments and our muscles just don't have the elasticity they used to have with the normal estrogen levels.
And in our conversations in the past, you've pointed something out, where it's like, oh, well, people are not working out because they're in pain, because they can't work out because they're in pain. And what you're teaching is that so you actually need to work out so you don't have that pain.
Right.
It's reverse.
It is. It is hard because, they have pain. Like the complaint I always get is I can't work out, I can't squat because my knees hurt. Well, your knees hurt because your muscles are weak. Women are notorious for having weak knees.
Listen
Always.
up, ladies.
Always. Because our leg muscles, for the most part, generally speaking, women have weak leg muscles. When you have an imbalance between your front and your back of your leg, your knee is very unstable, right? So our leg muscles are very weak, and that causes knee pain. So you have to start somewhere. So you have to set the foundation, start low and slow, right? So lightweight, slow reps, slow movement.
And it does make you wonder, like, some of the marathons, you'll see 75-year-old women in there, and they're faster than the 20-year-olds. But I feel like in talking to those women, those are the ones who's never stopped working out. They've always built muscle.
Right.
And that's what you're talking about.
Yes. Endurance sports is a different beast. You'll even see marathoners that don't look like they've ever ran a mile in their life, but they're marathoners because they've burned all their muscle off, right? And they carbo load before they run because they need to. So, but it's something, what women don't understand is the key to everything for their health is making sure as they're transitioning, going through menopause is like going through puberty, but on the back end, right? You go through puberty as a teenager, right? And we go through all those mood swings. We get crazy skin issues and all these things that happen to us, right? Then
I wouldn't know. I've never had a pimple before. I'm just kidding.
I know you haven't. You have that gorgeous skin.
I'm kidding.
But we go through all these changes, right? Our bodies change. You get hips and you get boobs and you get all these things. And then we normalize. Then we have children. Everything changes again, right? Then we kind of normalize. And then right around 38, our progesterone starts to drop, our hair starts to fall out.
That's crazy.
And women think it's because they're exhausted because they have their children and, this, which is definitely true. I had twins. I know how exhausting that can be. But it's also your hormones. Your hormones are declining, so your energy, your mood, even your microbiome in your gut changes because your estrogen receptors drop. And estrogen it moderates your gut microbiome. So it changes your gut, and then you're hungry all the time.
It's a lot to know.
It is.
And that's why, sometimes you'll hear people like, oh my gosh, I'm working out 7 times a week, but I'm not dropping weight or I'm not building muscle. You're saying that has something to do with your hormones.
It has 100% something to do with your hormones. And all of that is the base of everything else. So that affects your gut. It affects how well you metabolize food. It affects how you maintain muscle. It affects how you build muscle. It affects everything.
So when people are already in that, shape or that level of not being in shape, can they still find their way?
Absolutely. You can always, even an 80-year-old with severe osteopenia, osteoporosis, bone density loss, which happens with declining hormones, they can build muscle and increase their bone mass, even at an old age.
So it's never too late. You just need to know what to do. And that's where you're going to help us.
Yeah, and not hurt yourself, right?
Yeah. You hear a lot of hip injury, in the older ladies.
Let me tell you something about hip injuries.
How do you prevent that?
Lift weights.
Okay.
And I'm not talking about pansy pink weights. Right? Lift heavy shit is what I always say.
And that repetition that you said earlier, like that?
The example of the workout?
Yeah.
Yeah. That's all you need to do.
So repeat that again.
So my go-to workout when I don't have time to have like a 5-day split that week, and I know I only have 3 days to work out this week. This is what I'm going to do. I do a full body workout 3 times a week. And all it is I grab an 80-pound dumbbell because I can, right?
Oh my gosh.
So, but you can start with
25 over here.
Yeah, you can start with a 25-pound dumbbell. You start where you're comfortable. You put it on your back. You squat, however many you can do, 8 to 10.
What do you do?
I do 8 to 10.
Okay.
Bring it down. Do a deadlift, 8 to 10. Do a row, standing row, bent over row, 8 to 10. And then bring it up and push press, 8 to 10. That's it. It's not complicated. That overall builds more muscle and keeps you metabolically sound than running 5 miles a day.
I think we're going to have a lot of women with this one. But stretching, I know you're big on stretching too. So why is that? And how long do you stretch every morning?
Gosh, well, my husband will tell you every morning I probably spend 30 minutes stretching when I first wake up.
Okay.
When I'm drinking my espresso. Yeah, I stretch. I do. And it's not just stretching. It's more mobility, movement with stretching. And I just found my own routine that I just do, and mostly stretching out my hips because you're going back to the hips, right, with elderly people. So the baby boomers that are old now, they weren't really big on weight training and squatting and deadlifting, right? So you see a lot of hip injuries. You see a lot of breaking the hip. Your legs are your, I always say they're the tree trunk of your
It's true.
your body, right? If the foundation, your trunk is not secure, your body's not going to be secure. So you see those guys in the gym that are like, they're all big and buff up top and they have skinny little legs. They're going to break their hip.
Oh boy.
It does not matter how buff they are up top. If they're not lifting their legs, they're going to break their hip when they're 80.
Wow.
It's going to happen. And then what happens is when you break a hip, is your mortality rate increases by 30%. It's ridiculous. It is insane. Yeah. The survival rate is, if you're 80 and older and you break a hip, your survival rate post 3 years is very minimal.
Wow.
Yeah.
And it goes back to, if you want stronger hips,
you have to lift weights.
There you go.
You have to lift your legs. You have to build that foundation, build those tree trunks and make them strong. So if you do fall, you're prepared, right? You can bounce back. If you fall off a step wrong, you're not going to break your hip because you have enough muscle to support yourself.
Right.
Even if you fall.
That makes sense. And I want to ask you about menopause. So you think I'm going to enter that season soon. What am I supposed to expect with that?
Kevin should know that you're going to be really moody. No. Well, I mean, everybody handles it differently, right? I think it always helps because what happened with me is even though I was doing testosterone pelleting, I still felt tired. That was my thing was because I juggle a million things and then every 6 months I would hit a wall for 2 days and it'd get knocked out. For 48 hours, I would not be able to function. So when I increased my testosterone levels, that helped a lot. But the other thing is my estrogen was falling. So I went on the estrogen patch and I went on a progesterone pill. And that has worked wonders for me.
Okay.
Yeah.
And that's why I want, this episode to be focused on, and so we can provide help to the ladies. But the whole being hot, what's up with that?
So
I want to know.
Yeah. So your body's kind of going into this turmoil. It doesn't know how to.
And you can't avoid that?
So here's the thing. If you're eating a whole food diet and your nutrition is very protein centric and you're not eating chemicals and all the processed foods that surrounds us every day, it's very hard to avoid, you will most likely not get very many hot flashes.
Okay.
I've had 2.
Okay.
They did a study in Japan and they found out that the women of Japan do not get hot flashes.
Why?
Because they eat a pescatarian diet for the most part.
Okay.
Right?
I'm over here thinking ramen. Okay.
No, and they do have ramen, but they have a lot of soy. They have a lot of fish, and most of their food is whole food. It's not processed. The only thing that might be processed are their noodles, and half the time their noodles are either made with soy or with the mushroom noodles or something that is for the most part healthier than what we get here, unless you have imported noodles from Italy.
Got it.
So the less chemicals you have in your diet, the more whole food based your diet is, the less hot flashes you will have. But you will get them because your body is trying to figure out how to self-regulate. It doesn't know how to do that. It's confused. So one way that really helps women is doing hot sauna. Sauning is such an amazing, relaxing way to teach your body to self-regulate. Right? And if you want a cold plunge, that's fine too. You could alternate the two. But hot sauna is a really good way to teach your body to self-regulate.
Got the wet or the dry, or
Dry.
does it matter?
Dry.
The dry. And how long for?
20 minutes.
And you do that every day?
No.
Okay.
I probably sauna twice a week. It depends on my week and my schedule. I don't kill myself with a regimen, like I used to when I was younger. But because then that just adds to your cortisol levels and stress, so my whole goal is to decrease my cortisol, and that's why I don't do the cardio I used to do.
Run that by us. When someone's stress levels up, right? Like, what are the symptoms from that?
So there's good stress, right? There's good and bad stress. So we need stress. Stress helps our bodies adapt, right? There's sympathetic and parasympathetic nervous system. Parasympathetic is like sleep, rest, things that are relaxing. Sympathetic nervous system is fight or flight. The bear is chasing you, your heart rate goes up, your pupils dilate, you start sweating, you may lose hunger, you might increase your hunger, but whatever happens, your stomach microbiome changes. And some people get upset stomach, like irritable bowel syndrome. Some people get diarrhea. And then some people just overeat, right? So that's a more sympathetic nervous system reaction. And unfortunately, our society has created a chronic state of this sympathetic nervous system. Because the sympathetic nervous system is good for fighting off that bear that's chasing you, right? Because you have to. It's survival mode. But we're not cavemen anymore. We don't need that, right? Well, we still have it. Because all the stress that we have on a day-to-day basis consistently is keeping us in a sympathetic, elevated mood. So our cortisol goes up, our heart rate, our blood pressure, everything goes up. Our pupils dilate, we're just constantly like tense. Our muscles are tight. So when all of that happens, internally your hormones completely get shot, and then your cortisol levels go up, and that knocks everything off even more. So it's a constant, and I don't even know if I'm answering your question right now, but it's a constant state of stress that creates increased inflammation. And then you have systemic inflammation everywhere, and inflammation is what causes disease.
Well, and you are answering the question, and you are helping, because these are topics that everyone needs to slow down and pay attention to, because we're all going through that. But what's the best way to manage stress then?
Everyone always says meditate, and it's true, but it's so hard to meditate. It really is. I try to meditate twice a week. I try. But the more we meditate, the more we create a calm state of being in our mind, whether it's something fun, something you enjoy doing, that's repetitive, like even playing a sport, right? Like for me, I joined a women's tennis league. That's enjoyable to me. That to me is not working out. That is enjoyable. It decreases my stress. Whatever brings you calmness will help decrease your stress in your mind. That helps change the cell proliferation. Everything in your body systemically will lessen. Inflammation is caused by not just the increased stress, but it's it creates a vulnerability in a certain system in a body, right? So when you have a vulnerability in your, like I always tell my mom's story. So my mom she was amazing.
Yes, she was.
She was just this powerhouse, right? But she worked herself a lot. She was always go, 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 never rested. And ever since I could remember, she always had stomach issues. She had an ulcer, always. That was her vulnerable spot, right? When you get sick, do you have a vulnerable spot that always gets like most symptomatic?
Not really.
You know, I don't really either, but some people do, right? Like my husband always gets, sorry to put his business out there, but he always gets kidney stones. So I know that his kidneys are vulnerable. So your inflammation attacks wherever you're vulnerable, right? And inflammation causes disease, and the inflammation actually is what creates the cancer. So her cancer was all in her stomach and her pelvis region, and it attacked where she was vulnerable because it could, you know. So, and that was all because that's where she held her. You know, they say, "Oh, I hold my stress in my back," or "I hold my stress in my neck." You know,
Yeah.
Those are vulnerable spots, right?
Well, you brought up Mama Bear, Mini Jew. So now, sorry, but you opened the door for it.
Know.
So what? I know she impacted a lot of people. I've been friends with you guys for a very long time. I've seen it with my own eyes, and I have the utmost respect for you and who you are. I want to know how exactly your mom influenced you and what you could say to her if she was sitting right here.
Oh my God. You could have prepped me on this one.
Nope, we don't do that. I connect with Christina.
So I said this at her eulogy, but she always told me, don't ever let anyone call you a princess. She's like, I'm not raising a princess. And she's right. To me, I mean, and I have 2 girls, twins. They're going to be 15 in May. Mm-hmm. I don't want them to be princesses. I want them to be strong, independent. And that's what my mom taught me, to be strong and independent.
We're going to have you back because there's just so much to talk about. And the biggest thing is just, you know, having someone like you teach us all these little hacks because everyone's so busy. Everyone's trying to grind and hustle. And we forget that, guys, without our health, we have nothing.
You have nothing.
And that health is wealth. And that's the most important thing, yet we ignore it. So, and then when we do pay attention to it, it's too late. And so I'm just trying to bring people like you here to encourage, you know, people to be better about health, us included. Kevin's always been a healthy eater. Yeah. I love food, and
there's different degrees though. So, and I can show you I can help you navigate through the different degrees of being a healthy eater. To even having something that people overlook is the chemicals in your environment and what you use in your household.
We definitely need you back for that. Like, because that's a whole different subject. Even inflammation that you brought up, having the food, the relationship with food. Even, you know, when I spend a little bit of time with you, I eat differently the next few weeks, you know. But yeah, and then like I barely started to learn about the chemicals and things like that. And when I do share, you know, they think I'm crazy. And I'm just trying to educate so I can pass it on to the girls too.
Yeah.
But Dr. Yas, let everyone know how they can get a hold of you, please.
Well, my email is dryasmine@backfithealth.com. And then my Instagram is @Dr. Yazmine Rahimi. And our website is backfithealth.com.
Well, guys, thank you for tuning in. And Dr. Yas, we have to have you back. We literally have like a plethora of things to talk about. So thanks, guys.